Hi, everyone. Thank you so much for joining us. My name is Tara Kalk. I'm the project coordinator of the School Mental Health Initiative at the Southeast Mental Health Technology Transfer Center. We are very excited to present to you session 6, the final session of our Classroom-Wise course learning series. If you have any technical or audio issues during the session, feel free to reach out to us through the chat box or by email. And if you would like to share any resources, we encourage you to do so through the chat box, and also ask any questions. Feel free to turn off your mute and ask aloud or ask in the chat box. We're really hoping for today's session to be very conversational. So again, I encourage you to turn on your videos and feel free to speak aloud or message in the chat. All right, so for those of you who might not know about the MHTTC, I'll give a quick background. Today's session is brought to you by the Southeast Mental Health Technology Transfer Center, or MHTTC for short. And we're on the School Mental Health Initiative. So we are located in Atlanta, Georgia at the Emory University Rollins School of Public Health. And we are proud to serve the 8 states in HHS Region 4 that you see pictured here in blue. Our center includes faculty and staff with expertise in public health programs, finance, policy, and health systems. And this really provides us with a unique lens through which we can address mental health priorities in our region. The goal of our center is to accelerate the adoption of evidence-based mental health programs and practices by providing training and technical assistance to Region 4. And a quick disclaimer, we always want to remember that this presentation was prepared for the MHTTC network under a cooperative agreement from the Substance Abuse and Mental Health Services Administration. And the opinions expressed in this learning session are the views of our moderator and panelists and do not reflect the official position of the Department of Health and Human Services, or SAMHSA. And I am so excited to introduce Dr. Elizabeth Connors. She is an assistant professor at Yale University and a faculty member with the University of Maryland National Center for School Mental Health. Dr. Connors received her PhD in clinical community psychology, in clinical child and community psychology. And her work focuses on improving access to high quality mental health promotion, prevention, and intervention services, and supports for underserved youth and their families in critical access points such as schools and community settings. And I'll hand it over to you, Elizabeth.
Thank you so much, Tara. And we're so happy to see many of you joining us and also able to join us via video, and also to see folks introducing themselves in the chat. We're so glad to be talking with you about Classroom-Wise today. And as Tara said, today is to be a conversation. That's really our goal. We have some invited guests who are here with us today, both who were involved in the development of Classroom-Wise, but also some regional experts who have been doing a lot of hard thinking and planning about how Classroom-Wise rollout might actually look in their schools and districts. And so we thought for today, we would just kind of bring some of these folks together and have a conversation about what they're thinking and hearing about how Classroom-Wise can, really come into reality in our schools. So we encourage you to just be conversational throughout. You can put questions in the chat. You can unmute and share aloud. We're hoping that this will really advance our collective understanding of Classroom-Wise development, structure, and content. Our goal is always to increase our understanding of best practices to really support this resource as it's adopted and implemented in local schools. And at the end of the day, the reason that we have learning communities like this is to promote cross-state networking and shared learning about best practices for really advancing school mental health system implementation and use of training materials like the Classroom-Wise package. So if you have not introduced yourself in the chat yet, please do so. We love seeing who is on. So please let us know where you're coming from, your organization, your title. We know that we often have folks joining us from state level positions as well as district or local education authority positions, and also from local schools. So please share that with us. We know that we also have folks joining us from outside the Southeast region on a regular basis. And so we love when folks are joining us from Colorado, Arkansas, and some of these other places that I'm seeing coming in the chat. So all are welcome here, and please introduce yourself so we know who you are. Okay, so we want to start with just a very quick kind of 5-minute recap about ClassroomWise, what it is, where you can go to find it and learn more. Some of you may have joined our office hours throughout the course of the summer or may already be familiar with this, but we did want to provide just a couple minutes background to get everybody on the same page about what ClassroomWise is before we dive into some of our discussion. So this is a 3-part training package. You can go to www.classroomwise.org right now to check it out if you haven't been there before. The idea here with ClassroomWise is that it offers a free, in the public domain, 3-part training package. The audience is really K through 12 educators. This resource offers evidence-based strategies and skills to engage and support students with mental health concerns in the classroom, but it also provides a lot of great information about just what we can do universally to promote mental health and well-being and a sense of connectedness in our schools. It includes 3 parts here. A 5-hour self-paced online course, and I'll tell you in a moment what the pieces of that course are, as well as a video library and resource collection. And all of this is housed on a website for educators to promote their mental health literacy. We encourage you to check out this quick 6-minute video, which is on the ClassroomWise website, that really gives an intro as to what ClassroomWise is. So if you're interested in this resource and you want other people in your network to know about it, we encourage you to use the video so that you don't have to retell all the details of what ClassroomWise is and who it's for. So please use this intro video to your advantage for your own introduction, but also to share it with others. This is a course description. So if you want a sense of kind of what's inside the online course, there are 6 modules. These are self-paced. And the way that I think about these is that modules 1 through 3 really focus on promoting mental health and well-being of students universally. So you can see a focus on module 1 for creating safe and supportive classrooms. Module 2 is teaching mental health literacy and reducing stigma. And module 3 is on social emotional learning. Modules 4 through 6 are really looking at understanding and supporting students who may already be experiencing adversity and distress or other mental health needs. So module 4 focuses on exactly that, understanding and supporting students experiencing adversity and distress. Module 5 focuses on the impact of trauma and adversity on learning and behavior. So really, what are those linkages between trauma exposure and what we might see in the classroom? And then module 6 goes over some practical classroom strategies, what teachers can do to support students who are experiencing distress. So our prior office hours this summer have focused on 1 or 2 of these modules each. So if you want a sneak peek inside, please feel free to look back to our recordings for the office hours that the Southeast has hosted this summer. So to take the ClassroomWise course, just so you all know, it's pretty intuitive. You go in the upper right-hand corner where it says Launch Course, and just be aware it's going to take you to a separate website that's actually called Healthy Knowledge. And this is a website where there's lots of other training course materials for you. But what you want to do is click on the View Description and Enroll under the ClassroomWise portion. And then register. If you haven't already registered to have an account on the Healthy Knowledge site, you want to do that to go ahead and get started in taking the course itself. A few questions we get that I just want to touch on real quickly. There are accessible transcripts that you can download a PDF of. So if, before you go through the whole module yourself, or if you don't need to go through the whole module because you're going to be sharing it with somebody else, feel free to just download the transcripts and skim through all the content that's there if that's what you want to do. At this point, you also do need to have a passing score on each quiz to advance to the next module and take them in succession, modules 1 through 6. And please note that a certificate of completion for 5 contact hours is provided for you at the completion of all the modules. So if this is something that you're thinking about maybe requiring or encouraging for professional development, the learners can actually print off that certificate and have sort of that proof of certificate of completion that they've completed it. And don't forget about these 2 other amazing resources that are right on the ClassroomWise website. I love diving into these and I encourage you to check them out even when we're on the call today. So if you want access to all the goodies inside the modules, which is basically the beautiful videos and the resources, they've already been kind of pulled out and put right on the ClassroomWise site. So you can go into the video library and just really look through all the videos that are embedded in the modules. And the same is true for the resource collection. You can just, filter by module and see what resources are inside there. So please feel free to check those out. And this is just another listing again of the ClassroomWise modules. So again, those modules 1 through 3 are really for all students in school communities universally. And then when we get into recognizing and responding to students who may be experiencing stress, adversity, mental health risk, that's really the second portion of ClassroomWise, those modules 4 through 6. We have had questions about where people can go to just kind of get a bulleted list of the course content. If you don't want to dive into sort of all the transcripts and all of their detail, please access this resource, which is right online. So it's a nice little 1-pager of all the learning objectives and the overall course. This could be really helpful if you're thinking about how ClassroomWise might align with other content areas. If you really want to see like what's within each module that could align with other priorities. And we're going to have some conversation about alignment shortly, but this could be a really nice tool if you're thinking, I wonder how this aligns with our other mental health literacy training or our other content on sort of trauma-informed frameworks or SEL. This is a nice overall kind of course map to look at. So that's our very quick overview of ClassroomWise, just to provide some foundation. And we're going to be spending the rest of today diving in with some more conversation about ClassroomWise. So I hope this has at least piqued some questions and some curiosities for you and some ideas that you're going to be willing to share with us and ask of our panelists. And so before we dive into our panelist portion, we do have some poll questions that we want to ask you just to get a feel of the room. We're curious if you've completed any of the modules yet and how likely it is that you would be able to use these this school year. So we just want to get a sense of kind of where you're at with these different things with ClassroomWise. So take a minute to answer those.
Looks like we have about 50% of votes in. I'll give it another couple seconds and then I'll share the results.
Okay, if you want to see the responses, we need all the responses in. So let us know what you think on the poll. And we welcome complete honesty and transparency. It's just really helpful for us to know. We can kind of use this as some of the foundation for our conversation coming up here. Great, and some folks are typing in to me some of their feedback, which I love. So if you would like to use the chat box and type into me or any of our panelists, please feel free to do that. That's a great way to kind of let us know what you're thinking. So, all right, here, results are in. Survey shows many of you have not yet started the modules, which is completely expected. That's actually why we are having these office hours. This resource is still completely hot off the press. This was something that was just released at the beginning of the summer. So many people are still learning about it. So that's good to know that we have 42% of folks that responded who have not yet started. We also have about a third of you that have completed the entire course. So that's exciting because that's definitely been an increase over the course of the summer. So we look forward to your questions and feedback. Don't feel like you have had to have completed any of the classroom-wise modules to throw out questions or ideas today, because we have people in just kind of all various starting points here. It also looks like folks are feeling like this, it's fairly likely that you or people that you work with will use the modules this school year. So it sounds like we are interested in using this, but maybe need a little bit of additional support and conversation today to talk through that. So that's great. We hope that for those of you who are feeling very likely or likely that you're going to use this year, we want to hear from you what you're thinking, like how this might actually work in terms of the rollout. And so we're going to be talking more about that, because I imagine that there could be some similarities, but also differences in terms of how local school systems are thinking they could use this resource. So thank you so much for your time on the poll. All right. Feel free to enter in questions in the chat throughout, as well as if you want to unmute and ask aloud, we welcome that as well. So now we're going to start in talking with some of our classroom-wise developers. I know that there was a big development team behind classroom-wise. Many of us at the National Center for School Mental Health kind of chipped into this process, and also with the MHTTC. But we have here for you today Nancy Lever and Jessica Gonzalez, who were really at the forefront of the classroom-wise development. And so we wanted to hear from them a little bit about behind the scenes. So I have some questions that we know have been coming up from the field that I'm going to ask them first, and then we welcome for all of you to share your feedback and questions as well for Nancy and Jessica. So thank you for joining us, Nancy and Jessica. We appreciate you.
Thank you so much, Elizabeth.
So the first question is, can you just tell us a little bit about why Classroom-Wise was created in the first place? I know there's a lot of other materials and resources and trainings kind of out there in the field in this space. And so can you just kind of, if you think about, if you just rewind time a little bit, what was some of the impetus for Classroom-Wise?
Yeah, I think maybe I can start us off, Nancy.
Sure.
You know, back in, it seems so long ago now, but it was fall 2019 when our funder, which is the Substance Abuse and Mental Health Services Administration, reached out to us and said, hey, we really want the MHTTC network to develop a training package to assist educators in supporting the mental health of students in the classroom. We were like, okay, very broad. What are we going to do here? What's going to be helpful? What's going to be impactful? What is missing in the field? And I think that from there, you know, this was pre-COVID. And so we started to think about who would be best to work with us on this, who has the expertise, and how are we going to know what we need to include, what is going to be important for educators to know, because there is just so much, right, that we can tell educators to do in terms of supporting the students in the classroom who may be struggling with mental health concerns. And so because we had partnered with the National Center for School Mental Health already on several other products, we were like, hey, let's reach out to them. Let's have them serve as our content experts, and let's try to see what we can do that will be not only fulfilling the needs of our funder and the request, but also really thinking about what would be impactful for the field at that time, and something that is going to be useful in the future, right, Nancy?
Oh, absolutely. I mean, one thing that we know is if you ask people what they would want and you're willing to do the homework for them, boy, did we get input. You know, we very much wanted something that would be relevant and practical, very hands-on for the field. So like we had ideas. I mean, this is a topic from our many years of working in schools, collaborating with school-based, with school employed and community partners, working in schools, working with educators. We knew that there was an interest in having more training, more resources to improve awareness of mental health, identification, referral, promoting positive mental health for all students. But what we were hearing from everyone as we were thinking about developing this course is they wanted more hands-on resources, hands-on tools, practical application. Don't just teach me in an academic way, show me. What is it that we can do so that we can actually learn and implement and use these skills within our classrooms. So, we did the traditional reviewing of the literature, doing an environmental scan, looking to see what the best practices were. And we worked across the different MHTTCs, as you were saying, Elizabeth. There were a tremendous amount of people who helped to inform this from the different regional and national MHTTC centers. But I think what's unique about this is we really worked hard to get the voices and the input of teachers, of students. And
I still remember us, Nancy, when we met in person pre-COVID and we were all in this room, right? There was like 30 of us and we were trying to talk through what is it that we're going to do? What is important to cover? And after like a 2-day meeting, we ended up with why are we talking about this? Like we need to ask educators, we need to ask school mental health personnel across the country because it's going to look different for everyone. Those needs are going to vary. And I remember, Nancy, I think it was you or Sharon Hoover who said, not about us without us. Yeah. And that stuck with me, right? We don't want to develop something that's supposed to be very helpful for educators without input from educators themselves. We wanted to learn from them what would be impactful and in what way we could get them to utilize the information, this very important information that we wanted to put together, knowing that educators are so busy, they play so many roles, and not wanting it to be just another training, right?
Yeah, it's so helpful. And I'm curious, like, what was that process like? Did you reach out to educators and students and parents to provide input sort of on the front end, or did you prepare like outlines and materials for them to give feedback to you? I'm also curious if there's anything that stuck with you that you heard, like things that they gave you feedback on that maybe you didn't expect.
To answer your question, like when did we get the input? We got it throughout. And if you're going to involve, whether it's youth, families, educators, it's really important to get that feedback as you're developing. Don't go and ever get feedback on different products once it's already developed. We really wanted this to be driven by our educators. So as part of that, we were able to do, we did surveys, we did key informant interviews. We also had a focus group and really asked many open-ended questions like, what is it that you need? What are the most pressing mental health concerns? What would make you want to take this course? Where are the gaps? What would the appropriate length be? If there could only be 2 things that were covered, what would you want to see covered? So we really tried to give them a lot of different opportunities. And one of the things that I also think was unique, by having the MHTTC presence, we had the regional centers. So we had representation across. Nominations came from different centers, and we really included educators of all different levels and all different roles to help inform this. So it wasn't overly focused on any one region. We really tried to get that broader perspective.
Yeah, definitely. And I think something else to add to that is, Like I said, we started this back in fall 2019. And so this has been a work in progress for like the last year and a half. And so then when COVID happened, we were like, we really need this to still be very helpful during COVID, post-COVID, because at the time, you know, we didn't know what was going to happen with the pandemic. And I think that what was also happening at the time that was very, very apparent to us was, you know, like the racial protests that were taking place and just really this movement that's always been there, right? But just kind of like we were seeing a lot more of the importance of being culturally responsive in our trainings and resources. And I think that that is what we considered mostly in our recruitment of educators and school mental health personnel. When we wanted to get their feedback, we were really conscious of getting feedback from teachers from different ethnicities, from different cultures, and wanting to make sure that we were conscious of the cultural aspects also that go into play when we have teachers supporting students of, you know, that come from various communities and various socioeconomic levels, various ethnic groups. And so I think that's also a big part of what we considered when we were taking in feedback from educators across the country. So I just wanted to make that.
Yeah, it's such a good point, Jessica. And that's actually related to another question I had, because it's really a wonderful opportunity that this was developed by the MHTTC, as Nancy was saying, with that national reach. So you were able to get nominations and sort of feedback from people all over the country. And we have gotten some questions over the summer about just how cultural responsiveness and equity is represented in the modules themselves. So I hear what you're saying, that you wanted to be very explicit that people giving you feedback were themselves of a lot of diverse types of backgrounds. So you're really getting input from a variety of different types of folks. I'm wondering, how, you know, if you could speak a little bit to how cultural responsiveness and equity is represented sort of in the modules themselves.
Yeah, and I know, Nancy, you work directly with the educators and school mental health personnel and students that were a part of the videos, where we have, you know, included strategies directly from teachers, advice from students of what they would like their teachers to do to support them and their mental health. And so I'll let you touch a little bit on that, but I think that even just, it's apparent in the videos. If you all go look at our video collection, you'll see that we have students in elementary school, we have middle school age students, we have high school students, we have teachers from different ethnic backgrounds giving advice and tips and what's worked for them or what's been a challenge. And so we really wanted to include that educator and student voice and have it be from a diverse group. And so Nancy, I think maybe you could talk a little bit more.
Absolutely. We also, in terms of the content, we wanted to include some research, some best practices that we know, and really to give different strategies. So it's not only in the videos, but it's in the actual content of how can, you know, when you're thinking about mental health literacy, how do we make sure that we're keeping that cultural responsiveness and equity lens? You know, how do we do that? How do we reflect on the cultural lenses that we each bring, the biases that we have? How do you make sure you're creating a safe and supportive classroom for all students? So, you know, we were very much aware of this, and it's integrated across all of the modules, but we also know that that was not enough. And the exciting part, and coming soon, and you're hearing it here first, that coming soon we have an additional module, cultural inclusiveness and equity wise, that will be part of this whole series. So I would say throughout the modules, you will be getting, oh, Jessica's amazing, is already putting that in. Throughout the modules, you will be getting the appetizer of cultural responsiveness and equity, but we know we want to and need to go deeper. And the new module that's coming, the CIE module, will give an opportunity to go deeper and to really think more, to go have a deeper opportunity to consider cultural responsiveness and equity.
That's so exciting. Now, would that companion module be something that you'd recommend educators take after doing Classroom-Wise, or is it sort of a standalone resource? What's your vision for that?
I would imagine it would be part of it should be integrated. However, given that it has not been released yet, we'll say it could come afterwards, but ultimately I would highly recommend doing them all together, because I think it's really important to have that lens when you're working with students.
That's wonderful. Thank you. And, you know, along the lines of sort of making sure that we're including best practices in research and also representation in Classroom-Wise materials, I know we've also gotten some questions this summer about how Classroom-Wise maps onto other evidence-based approaches and materials. I think one of the advantages of Classroom-Wise is that it's not sort of overly branded with acronyms, and it really is sort of, the language in it is kind of broadly applicable. But I think then that also has generated some questions like, wait, is this still aligned with all of those evidence-based, sort of research-based approaches with students that we're familiar to seeing with particular branding? And so I just wanted to throw that out there and get your thoughts on that as well.
Sure. So in terms of what we created, everything, all the strategies that are provided are evidence-based or evidence-informed. And that was really part of our inclusion criteria, in which we worked with, our national center, the MHTTCs, the input that we received from educators and the literature. We made sure that everything we were doing was evidence-based or informed. And it really aligns well with, school mental health best practices, PBIS, social emotional learning, restorative practices, trauma-informed practices, basic cognitive behavioral strategies as well that are feasible in the classroom. So essentially, we're pulling out some of the components, like the nuggets of some of those best practices that you'll see across, as we have said, there are other mental health literacy programs. We're using some of those best practices, pulling the ones that we think were most essential for in the classroom. And one of the things that was exciting, I was able to join some of the office hours for the Southeast. And one of the things that I was hearing from the different leaders across the Southeast is that people were feeling that this did fit with PBIS, that this, the language, and we work, not only is it fitting, it really shouldn't be surprising, because we collaborated with CASEL.
Mm-hmm.
We worked with PBIS leaders. We collaborated across the MHTTC with people who are expert in trauma-informed care. We were very careful to make sure that the language that we were using, the strategies that we're offering, really have a literature base.
That's great. And I think, I agree that it's evident when you look at the resources and also the transcripts, right? You'll see language in there and content in there that I think resonates with some of the things we're more familiar with. What were you going to add, Jessica?
Oh, no, I was just going to say that I know that that's a question that's come up a lot throughout this series. And so I think that something that we are working on with Nancy and her team is putting together like a 2-pager, where we really outline the evidence base that we use for this content and how it aligns with some of those other mental health frameworks, and kind of using it as another resource for you all to utilize when you're kind of talking about Classroom-Wise and why it's important for your schools to utilize, and how if there is any overlap, it's not like, oh, because we are already participating in youth mental health first aid training, we can't do Classroom-Wise. It's more of, there are certain things that youth mental health first aid covers in depth that Classroom-Wise might not, but then vice versa as well, right? And so I think that that's something that we've heard throughout this series from our participants that would be helpful for us to kind of outline in like a quick 1 or 2 pager. And so I just wanted to let everyone know that what Nancy just said, awesome. We're definitely going to put that down on paper and make sure that we have that resource available as well on our Classroom-Wise website in the near future.
And speaking of resources, I think the only as we move forward, more resources are going to come out across the network, and similar to other products that we've worked on, that as we are helping different schools and districts and states move this forward, the best part about the work that we do together is we share it all. So as we're developing new tools, new strategies, we will make sure that those will be added to this repository.
That's great. Yeah, so you all heard it here first. Nancy said we want to do homework for you. So, and I know that throughout the, throughout the office hours this summer, we've really been asking you all to share with us, what do you need in terms of additional support, resources, materials? I know there was a poll question last time that indicated to us that people in the field would really like a discussion guide for each one of these modules. And so, I think the MHTTC and the National Center has just had a really strong track record of being really responsive to the field. So when we bring out a resource, it's never done and finished and without revisions in the future. We're always kind of keeping our ear to the ground and hearing what you all need in the field so that we can build on it and iterate and provide support. So we're serious when we say, let us know what you need to implement ClassroomWise, because we are taking notes. And as Jessica said, that 2-pager is already in development. So please let us know what you need. That's a big part of why we're hosting these office hours, so we can hear from you all.
Elizabeth, I can just add one thing that we haven't mentioned already. And one of the things that when we were developing, people wanted a training that would be good for educators when we think of traditional teachers, but really anyone in the school building. And I think that's important, that this could be relevant from your mental health staff to your health staff to your educators to your paras, to really get everyone on the same page when it comes to children's mental health and promoting well-being.
Absolutely. And I think even when we think about other school staff, like folks that are, working in the cafeterias, or school resource officers, our bus drivers, administrators, not everybody comes to an education space with this mental health background, right? So anybody that could benefit from learning more about how to support student well-being and positive school climate and connection, I think would all be very well positioned to take this course. So what other questions do we have from those of you who are on today? Are there other questions or comments you have for Nancy and Jessica, or other things on your wish list that you'd like to see come along with ClassroomWise? Oh, and I see Jessica put in a form. There's actually a contact us form that you can fill out directly right there on the website, or if you have a resource request, it goes directly to her team. So feel free to use that link for your wish list as well. But feel free to type in the chat if you have questions, or also we're a small group, so feel free to unmute and ask aloud as well. Okay, so please keep thinking on it and let us know. I see Shannon typed in that they would love to be able to use the modules separately based on school data from SHAPE and for staff development. So thanks for sharing that request, Shannon. Jessica, do you want to address that one?
Yes, and Shannon, I'm so happy that you're on. I know that we've been communicating via email about this, and I think the last time we connected a couple of weeks ago, I mentioned to you that I was definitely going to bring that request to our team. And Nancy, I know that we've spoken about this with your team, and yes, we are going to move forward with changing the way that the course is set up right now on the Healthy Knowledge platform. So right now, you go to the course and you must complete module 1 in order to get to module 2, and you take all of the modules in order to get your certificate of completion. And so now that we've released this, it's been about 2 months, and we've been getting a lot of feedback from those that have taken the course, which is over 400 learners already in the last 2 months. We have seen a lot of requests for having the modules kind of be available to access on their own. And so we met as a team recently to kind of discuss the implications for that. And yes, we definitely agree. We want this to be helpful for educators. And if that's something that's going to really make it a little bit easier for educators to access, or school mental health personnel to access, I understand sometimes it's, oh, we've already had this intensive training on SEL and maybe we don't want to utilize module 3 at this moment, but we want access to 4, 5, 6. Then, you know, of course, that totally makes sense. And we don't want to deter anyone from taking the training because of the current course requirements. And so definitely we are looking into that. We're hoping that very soon we will be able to change that on the Healthy Knowledge platform where the course resides currently. And we will definitely send out a huge announcement to everyone to let them know that that change has been made. And so again, it's just kind of talking through those little details about, you know, how are we going to get the quizzes in there and how do we provide a certificate of completion? Right now we have it set up for the 5 contact hours. Perhaps we do a certificate for, you know, a contact hour per module. So it's just kind of figuring out those logistics right now with our course platform team, but definitely something that we're working on. So Shannon, I have your email flagged and I'll make sure to follow up with you directly once we've made those updates.
And this is just a perfect example of tell us and we'll work with you. You know, as a disclaimer, if you're able to do all the modules, I would encourage that and encourage school staff to do that because a lot of the modules build on each other and refer back to each other. But absolutely, I think it would be meaningful if I would rather you do 1 module or 2 modules than none. So, and I agree completely with Jessica that our goal is to get this information out to the field. And part of our charge was to make sure it was free, but making sure it was accessible and practical. And you know, we want to take any input that you have and apply it. So we appreciate the input on that.
And this is Shannon, we appreciate the value of the whole course. I put in the comments, our state, which is a good thing, has mandated some very specific mental health training for all school staff. And we just cannot ask our staff this year to do 11 hours in mental health, but we want to still be able to use it in ways that make sense. So I'm really grateful that you all heard that feedback and we're open to that. So thank you very much.
And I'm honored that we might be part of your, whatever your number of hours allowed. We're happy to take 1, 2, 3, whatever you're able to do is wonderful.
Also curious, I want to jump in. I heard you say, well, Bob typed in too, and also Shannon, about the connection between SHAPE and classroom-wise. So I just want to ask for you to share, Shannon, how you're thinking about that connection. And like, are you thinking about results from the quality assessment, maybe indicating certain modules that would be good to train on, or just how are you thinking about that intersection?
We are just now thinking, to be really fair, we had these conversations last week when Tara presented at a different conference that we were attending. If we could do it in pieces, that felt like a good way. We're thinking about having the schools do those school level assessments rather than looking at our system level. We have 44 buildings, so our system view is like more than 30,000 feet really. And, but we are really focused this year. Our system goal is to prepare students for community, college, and career readiness. And one of our pieces, our 3 pieces, are equity, curriculum and instruction, and social emotional learning. So we really want to continue to look at ways to use data to help our school-based MTSS teams address learning, address, you know, continuous program improvement. And so SHAPE is one way to really bring some data around that. We have some others to then look at how we then give them resources to grow in those areas based on their identified needs.
That's great. Yeah, thank you for sharing, and please keep us posted on what you decide and how you see those intersections happening. I think that there are definitely particular sections of the school mental health quality assessment, like the tier 1 section or the needs assessment section, that depending on if that's something that you want to prioritize after a school, does the assessment, I think classroom-wise would be a really nice fit. I also know for the trauma responsive schools implementation assessment on SHAPE, there are a number of areas of that assessment that might indicate to a school that they need more training on the link between trauma and adversity and behavior, for example, or just mental health awareness and stigma. So this is, I think, a nice resource to partner with some particular areas of the assessments on SHAPE, depending on what you prioritize. Thanks for sharing that.
We will keep you posted.
That's great. And so before we move on to some of our other speakers today, I just wanted to see if Jessica or Nancy had any other things that you want to add that we haven't covered about classroom-wise so far. I think there might be some TA opportunities and other things like that coming down the pike.
Yeah, definitely. Just to close us up here before we move on to our other amazing speakers, I do want to share that we do currently have a classroom-wise technical assistance opportunity available. We have a request for applications open. The due date is August 13th. I'm hoping some of you have heard about this opportunity already and considered applying, but I know that, as of last week, I was looking at the number of applicants and where they were coming from, and I don't believe we have a school that has applied from the Southeast region. And so I just really wanted to bring this opportunity to your attention. I don't want to take away too much time from our other speakers. And so I'm going to put in the link to this special opportunity in the chat box in a minute, but just really quickly, just to give you a little bit of context here, as part of the launch of Classroom-Wise, we're inviting 24 schools from across the country to help us understand which technical assistance strategies work best to help schools implement Classroom-Wise with their school personnel. And so we really encourage you all to apply for this opportunity. Several more details about how we will support the schools that apply and are accepted to be a part of this project. But definitely don't want to take away more time, like I said. So let me just go ahead and enter the link in the chat box. And if anyone has any questions, please feel free to send me an email or chat with me in the box directly. But this is something that we are doing in collaboration with Nancy and her team. And so really encourage you all to apply if you are interested in obtaining additional support to help your schools, your teachers, your school mental health personnel utilize Classroom-Wise.
That's really exciting. Thanks for sharing, Jessica. And I hope that you get some more applications from the Southeast, and we'll make sure that we get the word out across the region so that we can have some Southeastern schools represented in that. I think it's always important to make sure that we have schools and districts represented from all regions, but we all have a special place in our heart here for the Southeast region and making sure that the unique factors of schools and students and communities in the Southeast are represented. So call to action, folks, please check it out. And we'd love to see some Southeastern schools as part of that effort. And totally free. I love the totally free. That's a good call. Great. All right, so we're going to move on to our next panelist, but I know Nancy and Jessica are still on with us for a little bit. So if other questions come up, please, really anything at all. No question is too basic. Type it in the chat or stop us and ask aloud. But thank you so much, Nancy and Jessica, for coming on and giving us that behind the scenes.
Thanks, Elizabeth.
Yeah, our pleasure. Thank you.
So next up, we have a leader from Henry County, Georgia. He's the Director of Student and Staff Mental Health and Wellness. Fred Lachar, am I saying your last name correctly, Fred?
Yeah, you did an amazing job. Thank you. Yes.
Thanks. Okay, we probably should have practiced that before we got on, so I'm glad that I figured it out. Well, anyway, thanks for being on. We were so happy to be connected to you and hear about your county's interest in Classroom-Wise. So just to start it off, can you tell us a little bit about like why your county is interested in using Classroom-Wise this year? What about it has kind of drawn you to it as a resource?
Well, and like I said, the data shows the need for it. And one thing that we saw as we went through the pandemic over the last year, as we go through it now, it highlights the needs that are in our buildings. One thing we focused on a lot in our district was, And a lot of times you hear the word preconditions. You know, what needs to happen in a building for children to be successful? And I always like to change the word to conditions, because it's always ongoing. It's never we fix this and now we can stop doing it. It's a space that we create that is continuous throughout a child's experience. And so the district knew that this was a need that needed to be addressed. So as we built out our 5-year strategic plan, there's a section that's devoted strictly to wellness and mental health of adults and students. It's written into our DNA now. So it's not just something that we want to do. It's something that is actually backed by research, backed by community demand, and backed by the needs of what we saw in school buildings. And then we even built board policies around the idea of access, opportunity, and outcomes for our students. So, you know, we saw this as a great resource to start building that alignment of systems that we want to see happening across Henry County. So this is such a great resource. So instead of us trying to pull pieces here and there, this was a really wonderful alignment of modules from the first to the last to help guide us through this work. So, you know, we had a need, and this was something that helped support that need.
That's great. And I love that it's something you got written into your strategic plan. It sounds like it's had a lot of support there in your local community, but having it written in that way is one good way to ensure that it is part of the landscape and the ongoing sort of conditions for learning that you're preparing your students for. Some folks know that I really am a data enthusiast, and you mentioned in passing that some of your data indicated that this was a real important need for your students. Could you speak to that? What sort of metrics were you looking at that really alerted you to the need for focusing on mental health and well-being for students?
Like I said, we always look at our attendance, we always look at our grades, but what we do is we also use surveys. And so, you know, we're very particular on the surveys we use to assess do students feel safe? Do students feel like they have a caring adult in the building? Do students have someone they can go to? Are they feeling anxiety? Are they feeling depressed? So it's not just a guess. All our kids from K through 12 answer surveys twice, sometimes 3 times a year, depending on the school, to assess those needs in real time, and then to address those needs in real time. Like I said, and one thing we use those data is we address the building needs, and we also address a teacher need, because if a particular class or grade levels having higher demands in a certain area, we know how to do a wraparound service for support for that particular school or even for that particular teacher. So like I said, and then the state of Georgia always has an end of the year climate survey, which dives into it too. So, but we have metrics that we use throughout the year just to do a little test of the adult wellness, but also the student wellness.
That's excellent. No, it's so exciting to hear. And I know many school systems have that sort of thing. And I also know that many school systems don't yet and are looking to build that. So if you're, if you're one of those folks on the call who are thinking that it could be good to gather some of that survey data, please know we have lots of resources available to you. And there's a lot of resources we have that we can point you to, for example, needs assessments to inform exactly what Fred's talking about. How do you provide sort of individual supports, but also really thinking about your system and what your system needs. So that's totally the gold standard. I love hearing about folks using data. So now back to classroom-wise. Sorry, I took us on a tangent there, Fred, but I do want to hear how you're planning to roll this out locally. So what does this look like? You've got the school year coming up ahead. Classroom-wise is going to be a part of it for you all. What is this going to look and feel like? Who are you training? How are you supporting them? How's this going to roll out for you there in Henry County?
Awesome. And one thing we learn through any kind of training is that sometimes you got to be intentional with the process, and you got to be systematic on how you want to roll out. If you just throw it out there and hope it sticks to the wall, you might capture some support, you might capture some capacity at some level, but it's not through the entire district. And the idea of any kind of plan or process is that at the end of the day, you can say that we've supported all students, we've supported all staffs, we've supported all communities, because you don't want one community to have a little bit more support than the other. So what we've done is we started the year off making sure that we went, Henry County in Georgia went and hired 53 mental health and wellness facilitators for every school in our district. So every school has a point of contact to lead this work. And we know as system leaders and school-based leaders, their plates are full. So being very intentional of having an individual whose job is to drive this work, to facilitate this work, and support this work ensures fidelity and consistency in this model. And then through that, we just didn't say, hey, you're in charge, now go do something. We were very systematic to ensure that each month that we've laid out the PD schedule for them to redeliver to all staff members. So they'll be redelivering on wellness, trauma-informed practices, conditions for learning, and all these different aspects to support a building. And classroom-wise will be one of those spaces where we have time already built into the schedule. So it's not something new. It's not something that's going to be sprung on a staff member at the end of the day. Go, oh, we're going to do this module. Hope you get something from it. It's going to be very intentional. It's coming up, and this is what we're going to do. This is what you're going to learn from it, and here's our action steps from it. So our first step really was to right now we're training our mental health and wellness facilitators because we want to make sure that there's an alignment in their work. And so we're really building the facilitators' capacity to coach and lead in this area. And once we get them homed up, then our next step is to push this into the school building and have those natural checkpoints throughout the year to make sure it's being implemented with fidelity. And there's a follow-up not only from the training, but also the implementation and support in the classroom.
That's amazing. I know that there may be folks on the line thinking we don't have 53 positions or one person in a building, because I know that the shortage of mental health support staff, even for these sorts of wellness positions, are always something that's tough, and particularly tough in the Southeast. So I just put a FYI in the chat box so folks know that these are new positions, right? These are just happening this school year. And so did you say it was CARES Act funding that helped fund them?
It's CARES fund, like I said. So like I said, there is money out there, and so as you start talking to your school-based leaders, your district leaders, there's money out there, and there's a lot of money out there to be used for this. And so it can be used to buy this kit, it can be used by this program, it can be used by personnel. So just being very intentional on how do you want to use it. And there's also a space where, again, if we didn't have mental health and wellness facilitators, we'd be leaning in on our counselors. We'd be leaning in our assistant principals because, again, as we think about development of a building or a school, we spend a lot of time on curriculum, reading, math, science, social studies. But if there's barriers in the way of our children, as there's roadblocks and ways that are preventing our kids to be successful, then that work has no value, and that work will never get done. So this is not something extra. This is something that should be interwoven through the curriculum. Be it SEL is not an additional piece. It's something that takes place throughout the school day, as this work too takes place throughout the school day. So this should be something that any leader could take over and run, because it adds value to what's happening in a school building, and it creates a place where kids can learn faster and at a higher level.
Mm-hmm. That's great. And thanks for sharing those, that perspective as well. I know you're a former school principal yourself, and I think the value of this to school administrators is so key. And so I think being able to message the importance in that way, if there are folks on who are needing to kind of talk to their school principals about onboarding this, I think, Fred's a great guy to pick his brain, but it's exactly that link that you're talking about, Fred, and just kind of those conditions for learning and the foundational pieces that students need for their learning and success. I know that when we had talked with you and also your colleague Jessica Stormer from Henry County, you talked a little bit about the role of these mental health and wellness facilitators, or coaches rather. What are they going to be doing with the teachers? Like, what does their schedule look like this year in terms of classroom wise? Are they going to be like talking with teachers after they take the training? Or I think maybe you said you've got certain dates scheduled already in the calendar.
Yeah, and we have the dates. And so really what we're going to do is going to be kind of that facilitator through the work. Be natural stopping points for conversation, breakout groups for a deeper dive into the work, because again, it is a great resource, and it's a standalone resource. It doesn't need a facilitator, which is wonderful about ClassroomWise, is that some products need a facilitator or need a guide for them to get from point A to point B with success. This does not. It can stand by itself, or you can have the ability also to use someone to help guide that conversation to make it more impactful for us, for we with our staff in the school building. All right, say, now you watched it, now you've done this. We've had some share out moments, ideas. Now, what is our actionable steps? We're going to leave here with some actionable steps that you're going to do to show that you take this material and you're going to be able to use it effectively to grow your own practice and be able to support our school buildings. So really, it's going to be more about them being kind of that support and those follow-up with those particular teachers who might need a heavier cycle of support, and also for those teachers that are rock stars, when they can kind of take this and move it a little bit faster too.
That's great. And are you going to be having all the teachers viewing all the 6 modules early on, or are you kind of pacing it throughout the school year? What are you thinking in terms of, you know, how you might spread this out or chunk this for your teachers?
It's gonna be spaced out. It's gonna be spaced out throughout the school year, and that's what we're looking at too. Because again, we're not looking to just do a dump. You know, it's you dump a lot of information on a teacher. Sometimes they can pick up the stuff they need and move forward. Our job is to space it out to ensure that, all right, we did module 1. Now we have some follow-up pieces that go with it, through conversations, through implementation, through other things that we, as a district, we already have. Now, we feel comfortable with this, let's move on to module 2. So because like when we think about the mental health and wellness facilitator for our building, and how we change the building, we're looking at not necessarily a 1-year change. We're looking at like a 3-year from start to finish of what this will look like once done and once fully implemented in every school building.
That's great. That's awesome. Yeah, and I think that makes really good sense. And I like the idea that you can kind of spend the school year really taking in this material, and that you also have a long-term view about this, right? And like you even said that in the beginning, talking about the conditions for learning, it's always an ever-changing landscape. This is not something where we're just going to check a box and move on and say, we did that. We did the student mental health stuff, and now we're moving on to the next, but really making sure this is part of kind of an ongoing conditions in your buildings, and sort of ongoing professional development and conversations for your teachers as well.
Yeah, and one thing also we've been thinking about too is also onboarding. As we finish this year and we move into next year with new teachers coming in, this is a great resource to put in their hands before the first day of school, saying this is something that we've already been through. Here's something you can kind of pace yourself through to get you on board, caught up to what the district vision is, and to ensure a safe space for all. So please, here's a great resource. Now, it's one thing that's always hard when you have new employees come on, is that whenever you have an initiative, there's always a gap. Because you always get new people come and new people leave. So how do we catch them up on that work we've done for 2 years? Again, it's a standalone piece. They can watch it and they walk in and they're caught up just like day one for those who've had a year experience with it.
That's great. I love that. Yeah, for turnover, onboarding new teachers, sometimes you have brand new teachers coming into the profession, and they want to get up to speed so they know they're ready to hit the ground running. And so I do think this is a nice resource to put in the hands of teachers so they feel like they've got what they need to walk in prepared. That's an excellent addition. Great. Well, I just want to open it up and see what questions you all have for Fred. Director of Student and Staff Mental Health Wellness in Henry County, also former school principal, administrator. Any other thoughts or questions that you have for him about classroom-wise rollout? Some of you said you were likely or very likely to use classroom-wise this year. So I'm curious if some of the plans that he shared may have piqued some thoughts for you all. I think, Fred, you must have given everybody a very clear blueprint for moving forward.
They're already sold on it, so my job is done.
So I think, you know, from our vantage point, and when we learned what Henry County is doing, you know, some of the things that resonated with us as some best practices that we were excited about is that you're positioning these mental health and wellness coordinators to support the teachers. So you're building in some coaching, and you're also taking this as kind of a year-long approach, and not just kind of saying, okay, everyone's required to do this as back to school training and you're done. I think your county's being really thoughtful about how it aligns with your priorities, but also doing it in a way that's going to feel supported to teachers. And so I think some of those elements that you talk through just really represent, I think, some of our vision, and probably Nancy could chime into, like, this is what we would envision would happen with classroom-wise rollout, I think. So let us know how it goes. We know there's going to be bumps in the road. That's how it, right? We can always anticipate bumps in the road in education and in mental health. So the best laid plans sometimes go a little haywire, but we're excited to kind of follow what you all are doing there with classroom-wise.
Awesome. I appreciate you guys so much. Again, Nancy, Jessica's, great in the team. This is a great work, great product. Like I said, and one thing that schools do need is strong resources and research-based products that can create change. So thank you guys for that.
Yeah. Absolutely. So if there are other questions that come through for Fred, please type them in. But we do want to move to our final panelist today because we wanted to make sure that we also have a bit of a state perspective here on ClassroomWise and how it aligns with school priorities. Many of you dialing in may be at the state level, or you're intersecting with state level leadership, or you're otherwise just kind of thinking from a systems view how ClassroomWise aligns. So we have for you here the fabulous Bob Stevens, who's been working with South Carolina for many, many years in many hats. And he basically serves as a statewide leader and consultant to a number of funded initiatives and programs in South Carolina. And I've heard that he has been already promoting ClassroomWise. And so we snagged him for you all to come and share with us some of the reasons that he likes it and how it's aligning for them in South Carolina. So we appreciate you joining us, Bob.
Thank you, Elizabeth. Appreciate it. I know I have one of my folks from Sumter County. I think Kathy, who's one of our aware districts, is on. Glad to see that she's here. What I'd like to start out with is South Carolina is, even though we're next door neighbors, is a little bit different than Georgia, certainly different than the situation Fred is in. That we're much more local control, not so much top down. And so what we have is a number of organizations, which I participate in a lot of them, and maybe that's why I've ended up in organizations and not with the state, that promote this work, that promote school-based mental health and school-based behavioral health. And like many states, we have aware districts. We participated recently in a program with Elizabeth called COIN. We also have obviously Association of Positive Behavior Support and a PBIS trainings that take place here. We have the Southeastern School Behavioral Health Alliances and the Behavioral Health Alliance and a number of other priorities such as those. And the way I sort of like to describe it, it was funny. I was in a meeting. Shannon has spoken from North Carolina, and I was in a meeting with Shannon last week. And a Carolina meeting. We're fortunate the Carolinas get together and talk about things on a regular basis. And Tara did a presentation for us. Thank you, Tara. We talked about the silos and breaking down the silos. And what I've discovered is with all the different groups that I work with, and that includes groups like Federation of Families and NAMI and the local SEL, the local Castle agency, who are all doing their own thing, is that we're all in a lot of silos. And sort of what has occurred is, I don't think we're in silos. I think we are all in our own triangle. We've all learned about the public health triangle, and universal and secondary and tertiary. And what I see is that was a big fight for a long time, but we've now gotten everybody on the triangle. Our academic people are on their RTI triangle. The law enforcement folks are on a security triangle. Obviously, the nurses and the health and the school-based health clinics are on the traditional public health triangle. You're on the behavior triangle. We have all the different triangles. So I see us in a whole lot of separate triangles, and the goal here is, rather than get out of the silos, get out of your own triangle and get in the triangle with everybody else. That's sort of my analogy here, and I really think that ClassroomWise allows us to do that. As Nancy said, they've been very, very deliberate about the language that's used. It's all evidence-based, and you've drawn this material from so many places. You'd be congratulated from that. So, when we talk to ANAMI, or we talk to the South Carolina Association of Social Emotional Learning, or the South Carolina Association of PBIS or PBS, we can talk the same language. And so what our job is to get now where Fred was, and say, okay, folks, within your district, let's get your district leadership teams better created. And I mentioned earlier, and Elizabeth brought up the idea of having SHAPE help us with that, because SHAPE is that has sort of the tools that you can use for implementation, get some data and say, here's where we need to go. Now, so what I am doing is I'm encouraging all of these different organizations to seriously consider using ClassroomWise. I'm going to give you a couple of examples. Because of the way we've gone about it, and as I said earlier, we have a lot of districts that work a bit independently. It's not so top down in South Carolina, although there is direction. We don't have the mandates that some other states have. That if for example, the big push now is in SEL, and we have different districts that have different quality of training, different types of training around social emotional learning. So I was at a district the other day doing some training prior to the school year starting, and they were really tied up and concerned about their teachers really didn't understand all the concept of social emotional learning. And so we took the module out of ClassroomWise and we showed it not individually, but we used it as a resource in some PD, and it was excellent. And then it worked so well that they then made sure other folks were getting to look at that kind of work. Having said that, I really like this entire package altogether. So when I'm talking to people like AWARE or people like the Southeastern School Behavioral Health Alliance, I really encourage the use of the entire ClassroomWise system, because what can occur if you don't is it ends up getting used like a cafeteria, and that's good. You can fill a need that you have right then, but you're missing such an opportunity. On the other hand, as was pointed out by Sarah or by Shannon and others, can we go in and ask people to do another 5 hours of PD right now, right when we're getting ready to start a school year that's requiring a lot of extra PD because of the pandemic? And we probably can't. So we're really doing a balancing act here. And I talk with my hands and can't get my hands on camera, so I apologize for that. But it's really a difficult balancing act for some of these organizations. However, again, I'm going to go back to what I said earlier, and that is the way that this ClassroomWise is structured. They've done such a good job with it. I come out of a PBIS tradition, and I spend a lot of time in schools doing PBIS classroom management training, because that's what principals want help with quite often. The beauty of ClassroomWise is the use of common language and a common approach that fits well within many of these others initiatives. In my case, particularly well with PBIS classroom management. They use the same language. It encourages the same language. It helps this teacher understand where they fall in the school behavioral mental health triangle, the triangle that they're functioning in, and allows them to really get this greater piece of connection. So that's where this has been very useful to me. And it's not just another thing. You can't come in and say, okay, everybody, here's another product that we're going to do, because we're getting that with our other groups. NAMI is doing that, and SEL is doing that. Everybody's promoting their thing. Here we finally have that one tool that can cross all these individual triangles to help them all get on the same triangle. And that's the beauty of it, particularly at the universal level, because that's the key here. We see more of that when we're at the tertiary level, when our mental health professionals are talking with other folks in the schools, but we don't see it as much at the universal level. And that's the real value of ClassroomWise. I'd give you a great commercial here, but it really is the one self-paced tool, evidence-based, free, that allows us to pull these things together in a way. All of these different organizations that I work with independently, we can see how it's a tool to really help pull them together. So that's my little commercial, but it is very effective and really does work in that way.
Thanks, Bob. It's so helpful to hear, and I know that PBIS is really a strong framework that's implemented throughout South Carolina, as well as many other states, obviously, and that you've been working within that triangle and framework for a long time, as well as just many other frameworks that are happening in South Carolina. It's been a stronghold for school mental health for decades, really, of doing very strong school mental health work. So it's such a pleasure to hear that ClassroomWise is a good fit in a state that already has a lot of school mental health focus and a lot of other frameworks and priorities related to school mental health.
We don't have the tradition of pulling them together, though, and this really allows us to do that. Everybody's been working on their own, and as I said, on their own triangle. And so this is recently in their own triangle. This is a good way to pull together, and really for the teachers, I can't express enough the need of that common language is so critical. And that helps our schools work so well together and helps our individual teachers work well together. So that idea of common language, the common ways that you approach, the way that you use routines in the classroom, the way that you use positive reinforcement, all of those things we hear from PBIS is really reinforced here. And I can go in and do a PBIS classroom management training. And I've now started using this material as part of that training. It doesn't add any time, but it really connects to. So it's very useful in that way. And I'll be quiet now, but thanks.
Yeah, and I mean, and even like, there's some videos on how to provide specific labeled praise, and that's provided for elementary, middle, and high school, right? And there's a ton of examples like that where I think for those of you on the call who may be in the position like Bob and others who are providing PDs already, you can also draw on the resources in ClassroomWise and the videos to really bring alive some of the concrete and practical strategies that you're already training on. So we encourage that. Fantastic. Yes, Bob?
Yeah, I did want to say one thing, because this is a discussion, in my case, a little bit of the state. And one of the things that ClassroomWise has now started to do is I'm having these conversations. These statewide organizations didn't discuss as well between themselves as much as they would have, and ClassroomWise has helped driving that, as the SHAPE system is as well. But ClassroomWise has helped driving that statewide conversation about what needs to be included. So appreciate that. Thank you.
That's great. Thanks. Yeah, keep us abreast of what's happening there in South Carolina. If there's other state leaders on the call, or even district leaders who are working on alignment generally, or alignment of ClassroomWise, I know that we've worked with the Southeast to do a lot of supports for states around this issue of aligning different things, different triangles and priorities. So let us know where your work leads you with that. And we're excited to hear that ClassroomWise is a good common denominator across frameworks, particularly at the universal level. So that is wonderful. So thank you for joining us. If folks have questions for Bob, please add those into the chat or ask aloud. In the interest of time, I have a couple wrap-up slides here that I want to move us through with an eye on giving you some clear implementation sort of checklist and guidance, and then we'll wrap up with an evaluation at the end. So we've mentioned this before, and I think this has been mentioned throughout, is the goal of ClassroomWise is really to bring value added into sort of the existing marketplace, if you will, as it pertains to mental health training for teachers. There's actually a really well-known theory of adoption by Everett Rogers that emphasizes how important it is for any new evidence-based practice or initiative to be adopted, that it has to bring relative advantage, meaning that it's more advantageous or value added relative to what currently exists in the market. So if you're ever thinking about onboarding something new, that relative advantage piece is so important for adoption. And that's exactly what ClassroomWise has been suited to do in many ways. So it offers something that is, free of charge, can be self-paced, is relatively brief, is available 24/7, does not have to happen on a specific PD day or in a specific room, and is really designed to be practical, accessible, and engaging. So as you're thinking through your own ClassroomWise implementation planning, if this is something that you're interested in onboarding and are maybe at the school or district level, here are some just considerations you might want to think through, and some of this touches upon some of the pieces that Fred was referring to. So, you know, first you've got to think through the initial training, which is basically viewing the online modules. How do you want to roll this out? Is this something that's suggested or required? Are these online modules going to occur on, you know, certain dates? Certain modules have to be completed by. You heard from Fred, they're kind of spacing this out throughout the year. Maybe in some situations, you've got a couple PD days that are longer, that maybe you do want people to get through a couple materials, or excuse me, modules at a time. But just thinking through, what is your spacing going to be for the training schedule? And then, you know, the certificates of completion are offered. So I think that begs the question for you all as leaders, are you going to collect those? Do you have the bandwidth to track those? Is somebody going to be receiving them and filing them away and checking that off? I mean, that takes workflow as well, right? So you don't want to collect certificates of completion unless you've got somebody that's actually going to track that and be able to process that. But I think thinking through that piece as an option is helpful about the initial training plan. And we don't want you to stop there. And this is where I know the MHTTC and the National Center are here for you, and we've got your back. So please think through ongoing training support for teacher use. And think of this as a menu. You don't have to do all of these, but we want you to think broadly about how could you layer in some type of additional support beyond just the viewing. Are there team-based opportunities to discuss the modules and debrief after the viewing? Is there consultation or coaching supports that your mental health team or your wellness coordinators or your guidance counselors or whoever is able to provide? And if you're able to identify somebody or a position of somebody's to provide consultation and coaching, who might that be? And what does that consultation and coaching look like? Are they meeting with individual teachers? Are they meeting with teachers at the grade level? How are those teachers identified? You know, are teachers sort of opting in or self-identifying for consultation and coaching opportunities? Is this something that is on rotation? Is each mental health provider assigned a grade level? Just thinking through some of the logistics. We know that consultation and coaching, specifically when it's sort of in person, in the classroom, practice specific with feedback, is going to be one of the most evidence-based implementation supports after viewing online modules. So if there's even a little bit of consultation or coaching that you can layer in, or some of these discussions, that will probably be a big bang for your buck. That being said, everyone has limited time in school, so you have to really think through what is going to be feasible and supportive for everybody involved. And you might also consider some natural mechanisms for peer support and shared learning that already exists among teachers, cohorts of teachers, to add to the agenda some discussion of classroom-wise or some of these strategies, right? Can this be a standing agenda item, for example, at grade level meetings? Or I know some schools really like their PLCs or professional learning communities. Maybe there's staff meetings that are occurring in your building. Maybe there's other ways and modalities and mechanisms that people gather naturally for peer support and shared learning. So just thinking about if there are existing natural mechanisms and meetings that you can integrate a little standing agenda item on classroom-wise, or bring in one of your mental health providers to talk through one module at a time or something like that. We know time is precious, particularly in schools, and even this year, you know, there's so much going on in the current landscape of schools. So the more that you can think about embedding some of these conversations and supports into your existing structures and not adding on a brand new structure, will probably be efficient and effective for you. And then finally, we just want you to think clearly through the various roles and responsibilities. Schools are multi-level places, and you have professionals at a number of different levels that all have an important role and responsibility in supporting classroom-wise adoption and use. So some of those are listed here. Your administrators may be communicating about alignment with strategic priorities and student needs. I think Fred and Bob both spoke very well to that. explaining the purpose of this, how it's going to be integrated and supported, and then problem solving those things that come up in real time. We know that there may be barriers to this and actually using the strategies. So it really is on sort of the leadership to make sure that that's sort of being identified and addressed. And then the school mental health professionals, I think they offer a tremendous opportunity to support teacher implementation and talking through if there are individualizing strategies that need to happen for the teacher's style, the student's strengths and needs, culture, linguistic considerations, and grade level. Having school mental health professionals and educators partnering on some of that application is going to be really key. And let's not forget, please, to ask our educators who are and other school staff who are receiving this training to provide feedback about how it's going, what they think about the course, their experiences implementing it, and any needed adjustments. We know that that real-time kind of feedback from learners is critical. So with that, the last kind of closing question I want to leave you with as a thought question is really to draw on your own experience of a training that was well received and implemented in your district. If you can think back to like, oh yeah, we all got a training in such and people are still using pieces of that. What made it a success? What was it that really promoted kind of the ongoing implementation and use of that? Because we all have a lot of lived experience with implementation. We've all been through the implementation flops. And so I encourage you to think through those experiences and use them for the wisdom that you need to carry this piece forward with ClassroomWise. If you haven't seen it yet, there's a beautiful 2-page resource overview. So if you're one of those folks that needs to share this resource with others in your network, please access this 2-pager.